Hi, I'm Dr. Miguel Cruz at the Cruz Life Center in Burnsville, North Carolina. On this particular video, I want to show you some before and after x-rays of former patients of ours. And I also want to explain to you the difference between the different levels of degeneration that we often see in the spine. On this particular film is a before and after x-ray of a 13-year-old girl who was brought in after having a positive scoliosis screening, which is basically an abnormal curvature was developing in her spine. And if you look here on her spine, on the one here on the right, this line is a plumb line going from the center of the tailbone straight up. The red dots that you see there are on the middle of the actual spinal bones, and those red dots should be right on this line all the way up if it was normal. So you can see the spine is curving off to the left here. Here is the same young lady just 90 days later, and you can see that her spine is almost completely straight after just typical chiropractic adjustments designed towards realigning, getting better mobility and mechanics working into that spine. So what we're seeing here is a 33-year-old female who came in with some back problems. And what I want you to notice is some normals first. Normal healthy vertebrae, normal healthy disc, good vertebrae, good disc, good vertebrae, good disc. The vertebrae here looks good, but what you're seeing here is that disc is much thinner than the others. And there's a little fuzziness in there which is part of the decay process, but what you can see is that is not a healthy looking disc compared to the others. This is an early phase 2 decay right there. That is what happens when you just allow these problems to go on for a long period of time and they're not properly addressed. Here's an example of an older gentleman that came in years ago. He was a farmer, and his history was that of some chronic back problems, of which he went to his physician and was just given a prescription painkiller, which he was quite satisfied. He was able to work and do his things for his farming as long as he was taking his medication. But eventually the medication didn't work anymore. And that's when he ended up coming to me because, well, actually before coming to me, his physician sent him to the orthopedic specialist, and the orthopedic specialist took one look at his x-rays of his spine and said, well, you're old, you got arthritis, that's normal at your age, what do you expect? And so then he came to me. And after looking at his x-rays, what you can see is these two discs here and here are in fully a phase 3 decay process, and you don't have to be an expert to see that they're not very pretty looking. My answer to that farmer when he told me what his other doctors told to him, well, I said, well, sir, I understand what they're saying, but here's what I want you to realize. Right above there is a perfectly healthy looking disc, and right below there is a perfectly healthy looking disc. And I'm relatively certain that those two discs are just as old as these two discs. So the question we have to ask ourselves is not so much the age, but why is it that these two discs are wearing down so much faster than the other discs? And we can go back to one of the other videos where we talked about the analogy between your front end of your car and your tires. If that front end is out of alignment, it will cause your tires to wear down prematurely and unevenly. Granted, as we drive the car, those tires will wear down slowly but surely, but it's an even process, which as we get older, we can expect some wear and tear. But when we've got one or two discs wearing down 90% faster than the rest of the spine, then we need to be suspicious of what else is causing the problem. And then we can go right down to the description of subluxation, and that is the process that happens from long-term subluxation and not properly addressing the issue. We were still able to help this gentleman. We got him a better quality of life. He was able to go back to some farming, but realizing there were limitations that he was just going to have to deal with and take care of the spine through the rest of his life. For this last x-ray, I just want to go back to the process of as we get older and what happens to the spine, but it's really never too late. This is an 89-year-old female who came to me with significant issues with their spine and other health issues. As you can see, she's had a hip replacement, heart surgery, and that's a pacemaker right there. And if we look at some of these measurements, there's quite a few things out of alignment within her pelvis. As the spine comes up, the farther up we go up the spine, the farther off center it is, putting a lot of stress on the joints and on the nervous system. So this person here, again, was 89 years old, and we went through a process of care, first of all towards getting her to feel better, but then secondly to try to get some restoration of her spine, some rehabilitation of her spine. And we were quite successful with that. After a year, we decided to take another x-ray of her. This is the same patient 1 year later. And you can see quite a difference before and after. The spine is almost 100% back to center. The pelvis is almost perfectly aligned right there. So she was quite pleased. I was pleased and surprised myself, because I can't tell you that we get these kind of results with our older patients. Heck, she was 90 years old when we took this x-ray. When they're 90, I'm just glad they made their next appointment, to be honest with you. So great results here, and I like to use this x-ray to encourage folks that it's never too late. We can get results at any age, from infants to well into the 90s. My oldest patient I ever had was 104 years old when they passed on, and we had gotten phenomenal results with that particular individual. So hopefully these demonstrations of these x-rays have been helpful. Carry on to the next video, and we're going to talk about the different adjusting procedures that we use in the office.